Good morning. This is Dr. Joe Moscato on another in the series of nursing teaching videos for Boone Hospital Oncology nurses. This is on Avastin in clinical practice, something that is becoming more important as time goes on. Now, Avastin, or bevacizumab, is in the class of monoclonal antibodies. Monoclonal antibodies are generally IgG proteins that are manufactured to target a single protein. Originally, they were made from a fusion of mouse splenic cells and multiple myeloma cell lines, but more recently they have been partially or totally humanized, which reduces reactions and decreases the anti-mouse antibodies. This is an example of an antibody. It has the smaller end, which is FC, which can bind to an effector cell, and the upper ends are the FAB portions, which bind to the target. Now, monoclonal antibodies may be naked or pure antibodies, such as Rituxan, Avastin, Erbitux, Vectibix, Campath, and Herceptin, or may be radio-labeled to radioactive particles such as Bexar and Zevalin. They may also be conjugated to toxins such as Mylotarg and Ontac. As you can imagine, the conjugated antibodies are more toxic, since you're also seeing the effect of the conjugation, the conjugated products such as Mylotarg, where it's conjugated to a poison, or the radioactivity. However, all can have infusion-related toxicities. Now, monoclonal antibodies are used in other diseases besides cancer. Tisabri is used for MS, Remicade very commonly used for ulcerative colitis and rheumatoid arthritis, Xolair for asthma, Soliris for PNH, and anti-OKT3 antibodies for renal transplant rejection, and ReaPro against platelets and cardiac cath. Monoclonal antibodies are large molecules that have to be administered IV. They do not easily penetrate the blood-brain barrier. Now, the other new classes of cancer drugs are oral small molecule inhibitors of tyrosine kinases involved in cancer. And these are drugs such as Gleevec, Tykerb, Sutent, and Nexavar, which are not part of this conversation. However, I will say this is how Gleevec works. And I think it's important because it is a small molecule that penetrates and works in a different way, and it's also in the new classes of drugs, so it gets confusing. Here we see a CML cell, chronic myelogenous leukemia cell, very active with the BCR-ABL mutation protein being quite active. With Gleevec, it blocks this, and it's a tyrosine kinase inhibitor, and the leukemia slows. Now, let's talk about bevacizumab. Bevacizumab, or Avastin, is a monoclonal antibody to VEGF, vascular endothelial growth factor. And VEGF is important to the growth of many cancers, especially renal cell carcinomas and brain tumors. VEGF is also important in the nurturing of benign blood vessels that grow to feed the cancer, also called neovascularization. Here's a slide or a cartoon of neovascularization, and one can see that VEGF stimulated cells grow new blood vessels, which are important in providing nutrition to cancer cells. Without blood vessels, cancers can only grow to a maximum of about 1 centimeter in size, and then no nutrients can no longer diffuse adequately into the cancer. And at that point, they begin to grow new blood vessels. But unfortunately, that also leads to an opportunity to metastasize. The other possible action of VEGF is to provide a route for chemotherapy. And this is something of a surprise, because using VEGF inhibition appears to close down small capillaries and improve blood flow through large capillaries, which can enhance blood flow to the cancer and may improve chemotherapy effect. So it's, in a sense, an effect on the blood vessel itself rather than on the cancer, although it delivers the chemotherapy better. Now, what about toxicity? All antibodies share the risk of infusion-related chills, fever, or even anaphylaxis. And these effects are related to the binding of antibody to the target. And therefore, the more target there is, oftentimes the more the reaction. And each antibody also carries some unique toxicities related to its target and its mechanism. Avastin is a recombinant, in summary, humanized monoclonal antibody, and therefore has less infusion toxicity. The major toxicity relates to its effect on new blood vessel formation and on existing vessels. Avastin toxicities are significant. The infusion-related toxicities are fairly limited, but hypertension is very common. In studies, doses were held for blood pressures of greater than 150/90. Life-threatening complications include bowel perforation, of which we've seen at least 2, hemorrhage, especially pulmonary hemorrhage and CNS hemorrhage, and wound healing problems. Other toxicities include thrombosis, minor bleeding, which is very common, especially nosebleeds, reversible posterior leukoencephalopathy, proteinuria and possibly nephrotic syndrome, and possibly, but rarely, CHF or neutropenia. Now, one must be aware of precautions, and this is important when you're seeing a patient on the floor because you need to know this. You need to be aware if the patient has been receiving Avastin. Elective surgery should be delayed at least 6 weeks and preferably 8 weeks after the last dose. Monoclonal antibodies in general have a half-life of about 3 weeks, and so it really has a significant amount still in the circulation at 6 to 8 weeks. Avastin should also be held until previous surgical wounds are healed, and it should not be given to lung cancer patients with squamous cell carcinoma or central lesions, since there's a significant risk of fatal hemorrhage in those patients. So in summary, Avastin is a promising new drug in the class of monoclonal antibodies. And while infusion toxicity is low, complications can be fatal. You have to pay attention to the complications, the bleeding history, recent or upcoming surgery, abdominal pain, and hypertension. Contraindications to Avastin include central lung cancer lesions, previous Avastin-related bowel perforation, wound dehiscence requiring medical intervention, serious bleeding, a severe arterial thrombotic event, nephrotic syndrome, hypertensive crisis or hypertensive encephalopathy. The indications are non-small cell lung carcinoma except squamous cell carcinoma, metastatic colon cancer, wet macular degeneration, and metastatic, most recently metastatic breast carcinoma, and probably in the near future renal cell carcinoma and brain tumors, although we're still using it in those indications, and ovarian carcinoma may be also have an indication in the future. I appreciate your attention to this. As usual, if you have any questions, please don't hesitate to ask us at any time, and I hope this helped in your learning process. Thank you.